These are unusual times, but our lives carry on, and so do the lives of our pets. So, how do we look after our pets when veterinary clinics are closed? I'm joined by Dr. Paul O'Neill, who, along with his wife, Dr. Barbara O'Neill, are veterinarians and own clinics in both Gananoque and Brockville. So, Paul, my dog is thrilled to have me at home all the time, but what happens if she gets sick? What precautions should I be taking to make sure she doesn't get sick?
So the regular normal precautions that to make sure she doesn't get sick by keeping her diet fairly consistent. When you're home with her all the time, our inclination is to overfeed her or give her treats when we feel stressed. And if she does get sick, your veterinary clinic is probably doing emergency care. So if you call them, they likely will look after you. If you have been exposed to the coronavirus, then they may do a telemedicine. If you haven't been, they would see you possibly outside, keep you outside their clinic. And that's what most veterinary clinics are doing now.
Okay, so I can get care, but um, so it sounds a little more complicated than our usual visit. So, is there anything I should be doing? So, I know the table scraps, but anything else I should be doing just to make sure that we get through this and not have an emergency?
Consistency of diet helps. What can happen a little bit is you may lax on your preventative medicine now because we're not really doing that, but trying to keep your dog from getting ticks. Lots of us are out walking a lot more than we usually do. So you may be able to pick up at curbside tick prevention from your veterinary clinic. So because your dog probably is getting more, maybe hopefully more exercise than it has in the past when you're working, when you're home. So keeping its tick prevention on there, making sure that it doesn't ingest things as our houses become a bit more in turmoil with no schedules, that they don't counter surf and get stuff off the counter that would bother their intestinal tract, that sort of thing. And out in the woods with ticks, keeping them on tick prevention and checking them for ticks every day for Lyme disease.
Okay, it's great. So there's a advantage and different things that prevent fleas as well as ticks. Is that how that works?
That's right. So Advantage or Advantix are a couple, and Brevecto or NexGard are a couple of other brand names that they're applied usually every 1 to 3 months, and work really well to keep them from getting ticks and then Lyme disease. So that's a worry that as springtime comes, they will pick up Lyme disease, especially when we're behind a little bit on our regular preventative care.
Are there any services that are not available to pet owners?
So now through this time of mandated by the Ontario government, veterinarians are providing emergency care and emergency service for people and their pets. And that usually entails if they're sick or injured or in somewhere of a serious or critical situation. So it may entail ongoing cancer therapy or infections and that sort of thing. You can't probably, we're not administering routine preventative care, so normal spays and ovariohysterectomies or neuters, they can wait until this crisis is over. And many of the routine vaccinations can be delayed. Some of them may not be able to for young animals, but if your animal is in trouble, if you call your veterinary clinic, they will likely see you, and they may see you outside and take the animal from you. You're not allowed in, but if your animal is in trouble, you can get them looked after.
That's something else that came to mind. It was 3 years ago this month that I lost my other dog. And this was about that time of that in April when he was starting to go downhill, and I knew I was going to have to make some tough decisions. And what would happen if someone had an animal that was, clearly at the end of a happy life? What would I do in that case?
So if you communicate with your veterinarian, they will almost for certain look after you in that regard. And so that service is still available. It is a little bit tricky, as we experience with our in with our relatives now is that being right with them is a very difficult situation. So sometimes we unfortunately have to be with our not we can't be with our loved ones now when they pass, and that's hard with our furry friends and family as well. And so it definitely can be looked after, but it's a little bit different situation in that keeping our social distancing and trying to be careful with our staff's health and our clients' health and to do a good job. Sometimes we will end up doing this service through a window and that sort of thing. And so that is played out each situation individually. But it makes it a little more challenging, but it definitely can be looked after if this is the time when your animal is suffering and we need to give them a little help. It can be looked after. It may be a bit different than you've experienced 3 years ago, but it definitely can be looked after.
Now, here's something else I was concerned about. If somebody pets my dog, should I be concerned about that? Should I wipe her down? Should I be concerned that her fur might have the virus that could carry to me?
It's low likelihood and low probability that it will transfer onto you. The virus won't stay on her very long. And so if the virus count is really high, it's not zero chance that you could get it, but it's very low. So it's not a zero, but it's not a high probability that you would pick it up from someone petting your dog. So, you know, if you are really concerned, you could give them a bath. That will eliminate the virus. Give it a bit of time so that the dog is quite dry, because it's often from moisture that they will transfer it. So your dog is low likelihood to spread it to you. Not zero, but very low.
That's really good news. And one other thing about cats. Should I be concerned about my cat?
So people are worried that they would maybe pick it up from their cat, and that's not a worry at all. Actually, there has been a large cat in the U.S. that has contracted the virus, but actually your cat is more at risk than you are. So you could give it to your cat, but they will not spread it to you. So if you are positive, you've tested positive for coronavirus, you probably should not be having your face in your cat's face. And so it's more of a worry for your cat than you.
Okay. Well, you've given us some good news in a time that there is very little good news. I want to thank you for being with us. Stay safe.
Okay, you as well. Thanks so much. Stay safe as well.